I'm Patty Haile. I'm a student in the Extremity Manual Therapy class at A.T. Still University. I'm going to demonstrate mobilizations on the upper extremity, including the shoulder, elbow, and wrist on John David, my son. He is simulating a 38-year-old male who was injured in a motor vehicle accident. He sustained an extreme fracture and dislocation of the right elbow, which required open reduction internal fixation, and he was casted in a long arm cast for 7 weeks. He's now been out of the cast 2 days. The elbow is very painful. He complains of pain at 7 to 8 of 10, and it's stiff. At the 90-degree flexion range, he has about 15 degrees of motion. This is classified as a 2A. And I'm going to start with the elbow because of the severe pain in the elbow and of his apprehension. I'm going to start with a simple physiological flexion in grade 1. John David, I'm going to just very gently move your elbow. It shouldn't really hurt, and it's just going to be very slowly and very gently, so let me know how it feels. Just relax. Okay? Okay. Now I'm going to move into a longitudinal movement of the radius. Grade 1. Feeling all right? All right. And now I'm going to do a posterior anterior glide of the head of the radius. And it's going to be a grade 2. That feeling all right? Okay. Now we're going to move down to the wrist. The wrist is very stiff. It has approximately 15 degrees of flexion and extension, but there's no pain. I'm going to start with a anterior posterior glide of the carpals on the radius. And I'm going to do a grade 4. John David, just relax. I'm going to take out the slack. And this is to mobilize the joint and to allow more extension of the wrist. Next, I'm going to do a posterior anterior glide of the carpals on the radius. Grade 4. With me? Taking up the slack. Okay. And last on the wrist, I'm going to perform a grade 3 anterior posterior rotation of the radius on the ulna at the distal radial ulnar joint. This will promote supination. Alright, now we're going to move up to the shoulder. The shoulder is limited in flexion at 90 degrees of abduction, 30 degrees of external rotation, and 60 degrees of internal rotation. He complains of pain level 3 out of 10, and he also reports that because of the weight of the cast, he has not moved his shoulder very much at all during the time he was wearing the cast. because of that, I'm going to start with a mobilization of the scapula. John David, can you roll to your side? I'm going to get his neck in a neutral position. Because the arm has not been moved well, I'm going to assume that the scapula has some proprioception deficit. It has a little bit of pain, and it might have some tightness. So I'm going to just start with the grade 2 medial rotation of the inferior angle. And this is going to help relax the shoulder as well as inhibit pain and provide proprioception input. How does that feel, John David? Don't relax your arm. Just relax. Relax your arm. Thank you. Feeling all right? Okay. Move back to your back. Okay. The next mobilization is a longitudinal glide of the head of the humerus in the caudad direction. I'm going to perform a grade 4 followed by a grade 3 followed by a grade transitioning into a grade 4. Relax your shoulder. There you go. I'm taking up the slack. How does that feel? Okay. Now we're going to do a posterior anterior glide of the humerus. And I'm going to start with a grade 4 and transition into a grade 3. So I'm going to take up the slack from the scapula. Into a grade 3. Both of these mobilizations, actually all three of them, are to stretch the capsule. The last one I'm going to do is a grade 2 lateral glide of the humerus. I could do this in his 90 degrees of flexion that he has, but because of his painful elbow and that limited range of motion, I'm going to choose to do it at his side. I'm going to place a towel roll under his elbow just to give it a little more comfort. Okay, John David, just relax. Okay. That is the mobilization of the upper extremity.